Review findings. 14. The review also visited operational sites and held discussions with staff, observed face-to-face PIP assessments, held focus group discussions with claimants, and met with representative bodies, professional bodies, and a regional tribunal judge. (15) The issues arising have been analysed under three main themes: the nature of the claimant journey, the way in which further evidence is collected, and the overall effectiveness of the PIP assessment. The claimant journey. The claimant journey during the early implementation of PIP has been characterised for many by the impact of delays and backlogs. The resulting progress chasing calls have been time-consuming and frustrating for claimants and costly for the department and assessment providers. While steps to resolve delays and backlogs are clearly necessary, they are not of themselves sufficient, and there are other underlying issues to address. Claimants currently experience a disjointed PIP process and have to navigate the joins between the different organisations involved. There is no need for major change in the delivery model in the short term, but there are areas where early improvements should be made and existing intent reinforced to enhance the claimant experience. These include communications, more proactive use of outbound communications with claimants, and clearer communications about what to expect throughout the process could help enhance the customer experience. Decision letters. The current format of decision letters is unclear and confusing, and the quality variable. They should start with a clear statement of the decision, followed by the award and payment details, a simpler explanation for the reasons and next steps. Training and guidance material on decision letter writing skills should also be strengthened. Strengthening the relationship between case managers and health professionals. There have been some examples of bringing the two together, either via co-location or ad hoc liaison groups, with positive reported results in terms of mutual understanding and better relationships. These approaches should be adopted across the board. Room configuration. It is good practice in clinical assessments for those being assessed to sit at 90 degrees or beside the health or social care professional. This is not consistent practice for PIP, and assessment rooms should be reconfigured. There is confusion about the rationale for reviewing awards known as interventions. And how the policy intent is currently being applied, with unclear communications to claimants. Some aspects of the disjointed claimant experience will take longer to address and will require an evolutionary approach. The longer-term aim should be to have a more integrated, digitally enabled process. An intelligent online system with better links to relevant information about claimants could support a more tailored service. The department should develop its future operating model for PIP along these lines. This will require more integrated IT systems. The earliest possible introduction of a facility for claimants to track the status of their claim, possibly an online portal, should be explored. End-to-end case management should be strengthened, together with a common integrated brand for the overall process. Obtaining further evidence. Obtaining sufficient, relevant further evidence to support effective assessments and doing it at the right point in the process is highly desirable. The current degree of success in so doing is variable. There is lack of clarity about responsibility for gathering evidence and how best to obtain it. A review of external communications could help ensure messages are consistent and provide clarity. There is also considerable scope in the longer term, if PIP is digitally enabled, for more effective collection of evidence at the early stages of the process. The department has started to look at the scope for drawing on relevant information it already holds for people who have had a work capability assessment, a WCA. Maximum use should be made in future of this and other relevant departmental information. Subject to appropriate data protection protocols, the potential for wider sharing of relevant assessment information held elsewhere in the public sector should also be explored. For example, health and social care reports. There is a tension between the claimant's view of GPs as their most trusted source of reliable evidence and GPs' own view that they are often less well placed than other professionals to comment on functional impact. PIP is widely perceived as a medical process rather than as an assessment of functional impact. Much of the terminology reinforces this perception, as do features of the face-to-face assessment. Effectiveness of the assessment. There is wide recognition that the assessment criteria reflect a relevant range of daily living and mobility activities. The review has not sought to revisit these definitions, which resulted from thorough development and consultation. The two areas where there have been questions raised about the application of the criteria are Activity 11 and the treatment of aids and appliances in the daily living activities. The consistent application of these should be monitored by the department. The assessment process should explore reliability as to whether activities can be undertaken safely, to an acceptable standard, and repeatedly, and recognise that conditions and impact can often fluctuate over time. While the review saw examples of good practice in these regards, respondents expressed concern over whether they were being applied appropriately. It is too early to draw definitive conclusions about the effectiveness of the PIP assessment based on available published data. Little has been done thus far to design a comprehensive evaluation strategy that will be reported publicly, and this should be remedied. It should be underpinned with comprehensive management information and research capability. The evaluation needs to build confidence that award outcomes are fair and consistent. Some concerns have been expressed about the challenges for claimants with mental health conditions and learning disabilities in navigating the assessment process. This may have an impact on whether claimants in these groups are receiving appropriate outcomes from assessments and awards. There is no hard evidence available to test this, so the evaluation strategy should include a priority focus on the effectiveness of the assessment for these groups. Current assurance and audit arrangements are focused on judgments reached in individual assessments, vertical scrutiny. This needs to be complemented by looking at the fairness and consistency of outcomes across cases with similar impacts in different areas, horizontal scrutiny.